Welcome back. My name is Jennifer Robom, licensed clinical psychologist and faculty for the Family Medicine Residency of Western Montana. I'm talking to you today about climate change communication. The learning objective for this segment is to identify several strategies to promote more effective climate change communication outside of the clinical arena. As I indicated earlier, I'll address climate change communication with patients in one of the clinical practice adaptations segments. Many of us are reluctant or hesitant to talk about climate change because we fear we don't know enough about the science. To some extent, this makes sense because what we communicate depends in part on what we know. It's certainly easier to talk about things that we feel confident about. But it's been suggested that decades of scientific research around climate change can be captured in these 10 words. It's real, it's us, experts agree, it's bad, there's hope. Our efficacy in communicating about climate change will be increased if we can capture these essentials. When talking about climate change and health in particular, it's helpful to say something which incorporates some version of these 4 points, according to researchers. The first is that climate change is real and human-caused. The second is that climate change is bad for us and for our community in a number of ways. The third is that we need to start taking action now to protect the health of our community's most vulnerable citizens, including our children, our seniors, people with chronic illnesses, and the poor, because our climate is already changing and people are already being harmed. And fourth, taking action creates a win-win situation for us because, in addition to dealing with climate change, most of these actions will benefit our health too. In whatever context you decide to communicate about climate change, you'll want to decide which of these points are most relevant to emphasize and which will be most compelling to your audience. That may well depend on whether you're talking to a patient, a legislator, or a colleague. For the remainder of this segment, I'll be quoting heavily from a resource from EcoAmerica entitled, Let's Talk Health and Climate, Communication Guidance for Health Professionals. I encourage you to seek out the reference on the last slide for more tips and insights. For starters, you want to start with people and stay with people. If you want your audience to care about climate change, then care about them. Start from their perspective, not yours. Do your homework to understand their concerns and priorities. This will allow you to relate to them and gain their trust. Infuse your entire communication with tangible, relevant concerns. Move from people to climate, not the other way around, and keep going back to people. You went into the health professions to help people, so this should come relatively naturally. Stay away from the science or the data and focus on the human beings before you. Connect on common values. If you really understand your audience's priorities, concerns, and values, you can open their hearts and minds by talking about these values and showing you share and honor them. Common values, such as family, community, choice and freedom, health, and fairness, are powerful motivators and connectors. Affiliation or tribal connectors, such as being fellow congregants, business leaders, organization members, or professionals, are also helpful. This goes back to tailoring your communications to your particular audience. This is not about manipulating people, but about finding common ground and then leveraging it for a more productive conversation. Acknowledge ambivalence. People approach climate from different perspectives and have different levels of concern, and we all have other priorities. Don't be self-righteous. Respect their perspectives and allow them their own space. A simple line like, some of us are more worried about climate change than others, allows people to be comfortable and listen with an open mind. It's important to remember that we're all ambivalent. I'll feel conflicted about getting back on an airplane again once the pandemic is over. I like an occasional cheeseburger. It's more convenient sometimes to order something online than to go to a local business. So it may be better to think about practicing harm reduction than abstinence, acknowledging our cognitive dissonance and our ambivalence, and thinking together about things we can do to reduce our personal contributions to climate change while pushing for more structural changes. Make it real and local. Many Americans still think about climate change as a distant concern. By focusing on local realities they can see with their own eyes, simple, irrefutable facts about changing seasons, local fauna, or record weather, you can make climate change relevant for them. Assume the realities, don't argue the science. Use a light hand with 1 or 2 examples, then pivot quickly to solutions. Think about yourself here. What made you first care about this issue? For me, it was the wildfires in 2017 near Missoula. Chances are it was something local and tangible for you as well. Emphasize solutions. Many people don't yet realize we've developed solar and wind energy systems that cost less than even cheap natural gas. Clean transportation and energy storage systems are just around the corner. We also have proven policies that reduce carbon pollution while accelerating economic growth. There's a suite of economic, health, nature, and security co-benefits that come along with energy solutions. Make a powerful case with tangible examples that show real solutions are accessible here and now and are creating safe and healthy communities that protect our family's health. Remember that emphasizing statistics can promote fatalism and emotional numbing, causing people to turn away and disengage. Solutions, benefits, and personal empowerment are the message you want them to leave with. Focus on personal benefit. You may also want to emphasize the immediate personal health co-benefits from taking action. For example, alternative transportation can reduce CO2 emissions that exacerbate asthma and respiratory conditions. Walking or biking to work can also reduce CO2 while helping people to lose weight and improve cardiovascular and mental health. And eating a low-carbon diet, more locally grown fruits and vegetables, fewer processed foods, less meat and dairy, can reduce the environmental impact of food production and transport while also improving health. When people realize that they'll gain benefits from climate solutions, they're more willing to participate. Use stories to strengthen engagement. Stories help make your message relevant and vivid. They connect with audiences, allowing you to build bonds, enhance empathy, and open people to new perspectives. Deepen your message by weaving in your personal story, how you became concerned about climate change, for instance, or an account of how you've seen climate solutions benefit someone or some community that your audience relates to. You already know as health professionals that patients or community members are sometimes more likely to respond to a story about another woman just like you, rather than the evidence base. Use a public health frame. Framing involves selectively emphasizing certain dimensions of an issue over others, setting the context for perception and discussion. Not surprisingly, a number of experts encourage us to frame the issue of climate change as a human health problem, rather than as an environmental problem, to help reduce political polarization and to engage a broader cross-section of the American public. This suggestion makes particular sense given the audience for this webinar series. Research has shown that a public health frame is more effective than an environmental or national security frame, eliciting emotional reactions consistent with support for climate change mitigation and adaptation. Using a public health frame also allows you to capitalize on your credibility and authority as a health professional. Listen. My final strategy is to stop talking and to truly take time to listen so you can hear who the other person is and what they're trying to say about climate change. You already know this. Every one of us can remember a time when we've made assumptions about a patient or a community member, only to recognize later that we'd erroneously jumped to conclusions, filled in the blanks, or took mental shortcuts because we didn't take the time to listen. Especially when we feel strongly about something like climate change, it can be hard to take a step back to really explore the other person's questions, fears, and concerns. As a health professional, you're no stranger to time pressure, but if you have time to listen, take it. So, in summary, when communicating about climate change and health in any of your roles as a health professional, consider first, covering 4 key points that reflect the research and convey a sense of urgency but also hope. Second, utilize a number of strategies from EcoAmerica to enhance your effectiveness, including start with people and stay with people, connect on common values, acknowledge ambivalence, make it real and local, emphasize solutions, focus on personal benefit, and use stories to strengthen engagement. And third and final, frame climate change as a public health concern and be sure to listen.